It is supposed to be the most exciting time of your life. Bringing life into this world, getting to hold your baby for the first time, then all comes crumbling when you experience all these emotions after childbirth. Today, I am going to talk about the face of motherhood that nobody talks about: postpartum depression. Postpartum depression affects many women around the world. Becoming a mom is the best experience, but can also be very overwhelming. Thankfully, with the right support, we can overcome this and be the best versions of ourselves to our kids. First, I will explain the definition of postpartum depression. Then, I will tell you how you can identify symptoms of PPD. And finally, I will explain some ways you can manage and treat postpartum depression. Okay, now let's begin and talk about how PPD affects us women. First, let me familiarize you with the definition of postpartum depression. Postpartum depression, short for PPD, is a medical condition that many new moms experience after having a baby. According to marchofdimes.org, it affects up to 1 in 7 women, which is about 15%. Postpartum depression is not the same as the baby blues, and it can last longer and be more serious. Posted by the CDC.gov, they recommend talking to your healthcare provider to get treatment, or you can visit their website to find resources in your area. It can be very serious if not treated, but thankfully there's many resources available to get help. Now let's talk about some of the symptoms that you can experience with PPD. New moms can experience the baby blues after childbirth, which can last up to 2 weeks. At the beginning of my postpartum journey, I simply thought that it was just the phase of the baby blues. Then I came to realize that it was more serious than that. Postpartum depression is many times mistaken for the baby blues, where you can feel anxiety, sadness, or trouble sleeping. According to the mayoclinic.org, the symptoms of PPD are more severe and can include loss of appetite, severe mood swings, crying too much, and even having difficulty bonding with your baby. Symptoms of the baby blues can last a short time, but if you are experiencing some of the other symptoms mentioned above, it is always best to talk to your healthcare provider. Finally, I will talk about some of the ways we can overcome postpartum depression. Finding support while dealing with PPD is key. Reaching out to your family, to your friends, and even your partner can be a big help. They can help you do simple tasks as giving you a ride to the baby's appointments or do some grocery shopping for you. Published by the womenshealth.gov, your healthcare provider can also give you resources such as going to therapy, prescribe you medication, or introduce you to support groups. Also, self-care can be a big help. Posted by momsbloom.org, you can benefit from staying active, eating well, staying hydrated, and last but not least, giving yourself some grace during this journey. There's many ways you can deal with it. Self-care at home, asking for support, or by getting help from professionals. So we talked about the meaning of postpartum depression, the symptoms, and how it can be treated. So next time that you see a new struggling mom like myself, be kind and ask how you can be of support during this journey. That being said, postpartum depression is very real and it affects many women, but we are not alone. Lean on your loved ones and ask for help. But most important, take care of yourself and give yourself some self-love.